As Secretary and Clerk, it is my privilege and pleasure to welcome you on this lovely afternoon to this graduation ceremony. Graduation ceremonies follow a tradition that began in the 15th century, and that tradition has developed since. Roughly translated, graduation means taking a step. And graduation symbolises the move of the former student, now called a graduand, into a new role in wider society as a graduate, there to use the talents developed as a member of this society. Each graduand will cross the stage and shake hands with the Vice-Chancellor to symbolise their transition to this new role, and we will applaud them for their success so far and in anticipation of their contribution to society in the future. At the end of the ceremony, the Vice-Chancellor will formally admit all those who have crossed the stage, symbolising that each and every graduate is now incorporated into the community of scholars. As new members of this community, as the academic procession leaves the platform, the graduates will join the procession, and that will conclude the proceedings. During the ceremony, those graduating with higher degrees will have their hood placed on them by the Vice-Chancellor, marking that they have attained the very highest levels of academic achievement. It is now time to begin our formal proceedings. And so I hereby declare the ceremony to be in session, and I call upon the Vice-Chancellor, Professor Michael Thorne, to address you.
Honorary graduand, distinguished guests, ladies and gentlemen, I'm delighted to welcome you all here today to join in this special day, a day in which we celebrate your achievements, the class of 2015. For most of us, graduation is a once-in-a-lifetime experience, so we do hope you'll enjoy it. But perhaps those here today whom it will most please are those who have supported you during your studies, parents, partners, children, and friends. To all of you, we say, we couldn't have done it without you. Thank you so much for your part in our success. You may have heard the news that we were declared UK Entrepreneurial University of the Year by the Times Higher Education magazine. The citation for the award listed a particular set of our achievements: the delivery of our degree-level programmes in the workplace for such international brands as Timberland, Specsavers, UPS, Harrods, Volvo, Wilmot Dixon, Barclays Bank, the Army, Navy and Air Force, the Port of Tilbury and Tamdown Triconics. The steps we take to enable our own students to graduate and to start their own businesses, and hundreds do. And the fact that through our subsidiary, Ixion Holdings, we have helped more than 9,000 long-term unemployed people start their own businesses, more than 66% of which have passed the all-important 6-month survival test. The help we've given governments who wish to improve their rate of new business creation in Romania, South Africa and Uruguay. The success of our postgraduate medical institute, set up as a partnership with all the hospitals in Essex, among others. Not only its success in research, we're running £5 million worth of clinical trials, but also because it now offers 5 master's degrees in surgery. And it recognised the establishment of our science park, what we call the MedTech campus, which is 120 acres of land located in Chelmsford, Harlow and Southend-on-Sea, and which should lead to the creation of 12,500 jobs for Essex. The news of the award of Entrepreneurial University of the Year, and I do like saying that, came hot on the heels of the latest official statistics, which showed that within 6 months of leaving us, an Anglia Ruskin graduate has a 9 out of 10 chance of getting a job, a better chance than most other graduates of securing a permanent job, and is likely to beat the average UK graduate salary. Not to mention the outcome of the 2015 National Student Survey, in which our students expressed record levels of satisfaction with their courses and placed us in the top 20% of UK universities, both for lecturers who are good at explaining things and who make their subject interesting. In December 2014, the government announced the outcome of its most recent official assessments of university research nationwide. We increased our previous 8 areas of officially world-leading research to 12 areas of world-leading research. They are allied health professions, architecture and built environment, art and design, business and management studies, communication, cultural and media studies, English language and literature, geography and environmental studies, history, law, music, drama and dance, psychology and social work and social policy. On the subject of research, our Global Sustainability Institute is a founding partner of the new Centre for the Understanding of Sustainable Prosperity, which was launched thanks to a £6 million research grant, hot on the heels of which came the announcement of a further £4 million to develop an energy modelling tool working with partners across the whole EU. Dr. Peter Brown from Life Sciences has published the history of how the harlequin ladybird has spread throughout the UK. The harlequin first arrived here in the UK 10 years ago and is described as the most invasive ladybird on Earth. Our Faculty of Medical Science has won a research grant worth over £3 million to help mild dementia sufferers. Researchers will develop an electronic platform which will help patients stick to their treatment and share data with their carers and doctors. For the 6th consecutive year, the prestigious Macmillan Prize for Illustration was won by a student on one of our illustration courses. This year, Xu Ti Liao was the deserved winner. A fine art student, Ramona Zolodek, won the biggest student art prize in the UK, a £20,000 bursary, after claiming the Woon Art Prize. And our New York Times best-selling author and lecturer, Dr. Una McCormack, has written a new Doctor Who novel called Royal Blood, which has just been published by BBC Books. Professor Richard Aspinall, the director of our Health and Wellbeing Academy, has been awarded the Lord Cohen Medal for his contribution to research in ageing. The world's first online local shopping community, solely for independent retailers, has been launched here in Cambridge, thanks to help from marketing students and their lecturers in the Lord Ashcroft International Business School. Called Hurry Here Now, the app connects local independent retailers with local shoppers, helping them to compete with large chains and online retailers. Dr. Nick Drydarkis's work on the effect of the current EU financial crisis on health and mental health has been published this year by Harvard University. His research has been much in our newspapers, especially that which showed that age discrimination against older people is rife amongst UK employers, and that gay and lesbian job seekers in the UK are less likely to be offered an interview. Our Faculty of Health, Social Care and Education is leading a study of a new app called ProAsk, which will allow parents to see if their baby has a higher risk of becoming overweight as the baby gets older. And a former student played a key role in England's Ashes triumph this summer. Spin bowler Josh Poisden, who plays for Warwickshire, was substitute fielder against Australia in the 3rd Test at Edgbaston. Josh, a former sports coaching and physical education student, caught Mitchell Starc to end the Australian innings, and England sealed victory later that day. I bet the Australians are glad that there's no former Anglia Ruskin student in the English rugby team. We now have over 16,000 students studying for Anglia Ruskin Awards off-site and at a variety of locations around the world. It is 25 years since we began delivering degrees in other countries, starting with College PTPL in Penang, Malaysia. Now we have students in Botswana, China, Germany, Hungary, India, Malaysia, Malta, Singapore, Sri Lanka and Trinidad. Over the last 10 years, we've spent more than £150 million on new buildings. And the most recent of these, for the Faculty of Health, Social Care and Education opened last month here in Cambridge. During the summer, work started on our £45 million new building for the Faculty of Science, also here in Cambridge, while major lab refurbishments took place in Chelmsford, ready for our new degrees in paramedic science and for pharmaceutical and physician associates. Now, before I close, I should like to take this opportunity to thank the members of the Board of Governors for their unstinting support and advice. But most importantly of all, I want to take this opportunity to offer my deepest thanks to the staff of Anglia Ruskin University, each of whom, directly or indirectly, has made an enormous contribution to your success. Everyone here today owes all our staff a huge debt of gratitude, and I think we should show our appreciation in the normal way. Finally, to all of you receiving degrees, diplomas and certificates today, if you enjoy the occasion, there is a way of repeating this once-in-a-lifetime experience. Study for a higher level degree. No matter what, you have a lifetime of learning ahead of you. You join a long line of distinguished alumni, which includes Chan Abraham, CEO of the Luminous Social Housing Group, Oliver Baines of Blake, who, having won Best New Album in the Classical Brits Awards, have now gone on to sell more than 500,000 albums. Lynn Berry, former CEO of the WRVS and now the chair of Breast Cancer Now. BBC presenter and our lecturer, Ben Garrod. Charles Clarke, former chair of the Association of Chief Police Officers. TV presenter Nick Crane of Coast, Mapman and Great British Journeys. Their honours, Judge Margaret Fawcett and Judge Howard Kemp. Alexandra Pringle, editor-in-chief at the Bloomsbury Press, and Mark Wood, chair of the NSPCC. We're very proud of you. Best wishes for your future careers wherever they take you. Do please keep in touch with us. Anglia Ruskin University would not be the exciting, vibrant and ambitious academic community it is today without you. Thank you.
We now come to the presentation of those receiving awards today to the Vice-Chancellor. But I should explain that each year we have a competition on the platform for the loudest applause at one of these ceremonies. Now, at the moment, the nurses and midwives in Chelmsford are ahead by a mile. I don't think you can beat them. Your Dean thinks you can. Let's see who's right. I now call upon the Pro-Vice-Chancellor and Dean, Professor Ruth Taylor, to read the names of those who will be presented from the Faculty of Health, Social Care and Education. Professor Taylor.
Vice-Chancellor, it is my pleasure to present to you today graduates from the Faculty of Health, Social Care and Education. For the award of Bachelor of Arts Applied Social Studies, Nora Agnes Otema. For the award of Bachelor of Science Nursing Mental Health, Rotimi Omole. For the award of Bachelor of Science with Honours Nursing Mental Health, Kikilomo Oluwayemisi Abieyo. Olga Antipenko. Josfat Chipangano. Sean Ian Day. Nicholas Fain. Emily May Faraday. Ben Fraser. Nicholas Johnson. Alois Kadje. Eva Kuzvinet Sekashiri. Abby Lee Larrymore. Sikei Maburu. Farai Maringa. Kirsten Matthews. Betty Mavunga. Sarah Mowat. Richard Mocambero. Peter Olatoye Ojajuni. Tracy Perrott. Kirsty Louise Bruce Woodward. Daiga Rudzite. For the award of Bachelor of Science with Honours Mental Health, Bianca Best. For the award of Bachelor of Science with Honours Nursing Adult, Natasha Adams. Jacqueline Arbon. Emma Rose Bannister. Kerry Ann Barber. Kerry Ann Biggerdike. Polly Bircham. Charlotte Victoria Bostock. Victoria Bristow. Katie Cheeseman. Deanna Rose Clark. Kelly Dean. Charlotte Dickerson. Sarah Digby. Abigail Florence Early. Chloe Luann Eddings. Jessica Evans. Winston Felton. Emily Fisher. Laura Fisher. Holly Fox. Nada Nadarkwa France. Richard Charles Allen French. Danielle Frost. Nayari Garande. Leila Giller. Lucy Ginn. Sheridan Goff. Emma Celine Grimshaw. Charisse Hagger. Katie Hart. Tina Hastings. Rachel Horton. Emily Huckle. Poppy Heiner. Nardine Nicola James. Leanne Jenkins. Catherine Johnson. Veronica Chulufia Kabemba. Katie Keane. Fatumata Keita. Emma Kelly. Susanna Kelly. Jessica Ellen May Knights. Rebecca Long. Omolola Madariola. Charlotte Manley. Janet Maponga. Heather Masters. Alana Mackay. Samantha Mackenzie. Georgina Mitchell. Aisha Mohammed. Vaida Moyo. Vin Mpofo. Lillian Wanjiku Manuri. Malachi Needham. Mabel Nyabani. Esinati Nyaruwanga. Laura O'Driscoll. Ibn Kanolo Bolaji Ogunbotai. Victoria Olive. Merenciana Oliver. Laura Ostler. Katie Payne. Marina Pankratova. Louise Pierce, who also... Louise also received the Dean's Award for the Department of Nursing and Midwifery. Anne-Marie Ada Pedzani. Alice May Phillips. Avril Papara Vagizi. Stacey Ponton. Charlotte Primrose Proctor. Rachel Potts. Bethany Ricketts. Jean-Marie Rivera. Josie Shipp. Caitlin Smith. Molly Spinks. Samina Jade Stali Chudasama. Katie Stevens. Zoe Stevens. Chloe Victoria Swamborough. Sharina Thomas. Chelsea Tomlin. Victoria Helen Turner. Rebecca Ann Wakeham. Sophie Mia Wardell. James David Watson. Becky Whitehead. Sophie Winter. Hannah Ray. For the award of Bachelor of Science with Honours Nursing Child, Holly Byrne. Rebecca Cavill. Samantha Louise Dennis. Michelle Emily Ann Eleftheriadis. Nicola Geegan. Sophie Graham. Jessica Jewell. Lauren Marshall. Deborah Malumba. Joshua Musk. Gloria Nanvuma. Amy Odie. Victoria Reeve. Gloria Santosh Kumar. Eleanor Studd. Megan Wilderspan. For the award of Bachelor of Science with Honours Midwifery, Dawn Ball. Vicky Louise Bell. Kirsty Clark. Charlotte Claydon. Kaylee Clement. Jacqueline Coleman. Kaylee Flanagan. Sarah Foster. Helen Garrett. Eleanor Gilbert. Claire Louise Grayston. Charlotte Hawkins. Rosemary Jones. Maeve Loveland. Rebecca Neal. Eleanor Nicholson, who also Eleanor also receives the Anglia Trust Foundation Scholarship. Janita Osei Poku. Lauren Jane Parsons. Roseanne Naomi Payne. Emma Rose. Emma also receives the Zita Killick Award. Amy Sampson Brown. Sophie Slater. Sophie Anna Spittle. Emily Laura Stringer. Harriet Tennyson. Madison Chandler Venture Page. Carly Lynn White. Joanne Woodhall. Lauren Amy Woodward. Vice-Chancellor, that partially completes the list of students for me to present to you today.
Each year, Anglia Ruskin University makes a number of honorary awards to individuals outstanding in their field of endeavour, who we hope will serve as an inspiration to those of you crossing the platform here this afternoon. Their stunning achievement should motivate us all by reminding us that we should see our own success to date but as a starting point. They pose the question, shouldn't we too aspire to success like theirs? I now call upon Sandy Lynham, Director of Estates and Facilities Services, to read the citation for the award of Doctor of Health Sciences honoris causa to Halima Khan.
Vice-Chancellor, it is my pleasure to read the citation for Halima Khan for the award of Doctor of Health Sciences honoris causa. Halima Khan is a board trustee of Diabetes UK, previously a council member of the Winston Churchill Memorial Trust and Executive Director of the Health Lab at Nesta, the UK's leading innovation charity. Educated at Oxford University, where she gained a first in geography, Halima Khan won a Knox Fellowship to study for her Master's in Public Administration at the Harvard Kennedy School of Government. After graduating, her early career was focused on the field of international development in Pakistan and South Africa, and with the United Nations Development Programme. This experience was to prove good preparation as she turned her attention to challenges closer to home. In 2005, Halima was appointed as Head of Strategy for the London Borough of Camden, leading the Council's work on citizen participation and community strategy. In 2007, she became Deputy Director at the Prime Minister's Strategy Unit, where she developed policy advice for Number 10 and Cabinet Office ministers on a range of domestic issues, including health and social care. Then in 2010, she joined Nesta, where Halima was initially Director of the Innovation Lab. There, she has worked with innovators across public services, civil society, and business to develop and scale new responses to social challenges, such as ageing and public service reform. The aim of the Innovation Lab is to incubate and scale disruptive innovation for the public good. This year, Halima became Executive Director of the newly launched Health Lab at Nesta. The Health Lab brings together Nesta's practical work on health and ageing and aims to create a people-powered health system. This means providing healthcare for people when they need it, enabling people to manage their health in their everyday life, and connecting people into networks that help support one another. Health Lab's work is based on the concept of co-production, where solutions are designed and delivered with people rather than for people. This approach offers a viable alternative to the dominant model of public service delivery, focusing on reducing people's dependence on public services and empowering them to help themselves. It has been estimated that the NHS in England could save around 4.4 billion a year by adopting people-powered health innovations. Examples of Health Lab projects under Halima's leadership include people-powered results, in which Nesta works with frontline health and care professionals to achieve meaningful change in 100 days. Teams are supported to take on new behaviours that enable greater collaboration and problem-solving. Realising the Value is a programme to identify evidence-based approaches that engage people and communities in their own health and care. Health Lab also works on digital health, and particularly building communities of patients who use smartphones and wearables to create data that is useful to them day to day, and which is also clinically valid. In 2013, Halima published 5 Hours a Day, Systemic Innovation for an Ageing Population, in which she makes a compelling case for a systematic review of how we live our lives within an ageing society. In her report, she identifies significant differences between the current focus of ageing innovations and what older people actually want. With life expectancies increasing by 5 hours a day, she highlights the need for society to adapt to a changing demographic by taking a close look at how our social institutions operate and by finding new and smarter ways to help people help one another. A resident of Cambridge, Halima has spent her career to date striving to improve the lives of people with a wide range of health and social problems. And as such, she is an excellent role model for our students. By recognising her achievements, we have the opportunity to build closer links between our university and Nesta, and to share learning from our postgraduate medical institute's ongoing research into dementia and Nesta's work on health and ageing. We are delighted to welcome Halima Khan to our Anglia Ruskin community. Vice-Chancellor, It is my pleasure to present Halima Khan for the award of Doctor of Health Sciences honoris causa.
By the authority vested in me as Vice-Chancellor, I hereby confer on you, Halima Khan, the degree of Doctor of Health Sciences honoris causa. Our warmest congratulations.
Vice-Chancellor, graduates, ladies and gentlemen, I am delighted to receive this honorary doctorate in health, and I accept it to develop what we've called people-powered health at Nesta and beyond. Nesta is an innovation charity dedicated to supporting ideas that help improve all of our lives. And over the past 6 years, we have tested and grown new approaches to health and care which put people at the centre. I'm particularly pleased to be receiving this honour from Anglia Ruskin University. You are well known for your excellent training in health, care and education. And most importantly of all, congratulations to all of you for receiving your degrees, your diplomas and your certificates. And given how good you are at cheering, I think we need another big cheer for everybody who has received a degree, a diploma or a certificate today. Another big cheer. Thank you for coming. That's fantastic. And today is about recognising the dedication and the hard work it's taken all of you to get here today. Reflecting on my work in health and care, here are a few thoughts to share with you as you start the next stage of your professional life. Firstly, you are all highly valuable, whether you've trained as a midwife, as a social worker, as a nurse, in early years, in education, or some other related field, you are all absolutely essential to the future of a healthy and a strong society. In fact, the health and care system needs you more than ever. As you know, the system is under a great deal of pressure from rising demand and from financial stress. And because of this, what you have to offer is even more important. Your professional skills, your compassion, and your dedication to improving the lives of other people. And people like you are at the heart of what we call people-powered health. So what is people-powered health? What does it look like? I thought I'd give you a couple of examples of what putting people at the centre of their health and care looks like in practice. One is about the difference it makes when people are truly listened to, and the second is about staff problem-solving at the front line. The first example is a man I met in Huddersfield a few years ago called Paul, in his 60s, an ex-miner. He told me the shock of being diagnosed with a lung condition. He thought he just had a bad cough. The doctor told him to start exercising, but he left the surgery feeling overwhelmed, depressed. He was scared of doing exercise, getting out of breath, and what that might lead to. So he withdrew into himself and did less and less over time. And this, of course, made his lung condition much worse. So after a while, he wasn't able to move more than a few meters at a time. People-powered health is about moving away from failures like this towards a system that really knows how to support people like Paul much better. Firstly, it's about great conversations, conversations with professionals like you, conversations that are open and in which people are really listened to. In the end, Paul was connected to a specialist pulmonary nurse who talked to him and found out that he used to be a champion swimmer in his younger days. So with her support, step by step, he increased his confidence, and by the time I met him, he was swimming several lengths of the pool every week. In his own words, it was a miracle. The other thing that really helped Paul was joining a local peer support group with other people with lung disease. This group helped Paul to feel less alone, and it gave him new skills. He's now helping new members of the peer support group when they first arrive at the beginning of their journey with lung disease. So these two things, a professional really listening and connections with peers who really understand what it's like, are at the heart of what we call people-powered health. But the people in people-powered health are also empowered professionals. We do a lot of work with professionals to motivate and inspire them to work better together, focusing on a shared mission, something that can get lost in the busyness of frontline work in an overstretched system. In one hospital ward in Harlow, in Essex, very close to where many of you have been studying, staff were asked to help to improve discharge out of their hospital ward, and they spent time talking to patients. It turned out that the older, frail patients preferred to get home as early as possible in the day so that they could settle in back at home before night falls. But the hospital had always assumed it was important to give older patients one last hot meal before they went home. So they switched from an afternoon discharge to a morning discharge. And this wasn't only better for the people who could get back to their homes quicker, it was much better for the hospital because it freed up beds sooner, which improved flow through the hospital. And this came about from staff themselves, frontline staff, solving problems together. So given that, here are a couple of thoughts for you as you embark on your next chapter. Firstly, be a great listener. Listening is an incredibly powerful tool and really can make all the difference. Secondly, be a problem solver. When you see something that needs to be fixed, work with others to fix it. Sometimes the best solutions are the simplest. The combination of these, listening and problem solving, will, I think, set you up in good stead, not just for a successful career, but for achieving what's most important of all, making a real difference to people's lives. So thank you once again for the recognition of the work that I've been lucky enough to be involved in. I hope all of you become living exemplars of people-powered health in action. Good luck and thank you.
Dr. Khan, thank you. We now continue the presentation of those receiving awards today to the Vice-Chancellor, and I call upon the Pro-Vice-Chancellor and Dean, Professor Ruth Taylor, to return to read the names of those remaining from the Faculty of Health, Social Care and Education.
I'd now like to present to you the final group of students which are to be presented to you from the Faculty of Health, Social Care and Education. For the award of Bachelor of Science with Honours, Acute Care, Claire Elizabeth Burbridge. Marta Cole Lastras. Marcella Elizabeth Danglebert. Jessie Rani George. Jessica Amy Taylor. Elizabeth Janet Wheeler. For the award of Bachelor of Science with Honours, Primary and Community Care, Sharon Bradshaw Lal Singh. Cindy Marie Creasy. Sharon Louise Nightingale. Claire Pennycook. Charlotte Louise Richardson. Melanie Jane Robinson. Rhiannon Jane Saunders. Emily Tarrant. For the award of Bachelor of Science with Honours, Specialist Community Public Health Nursing, Health Visiting, Sheila Bailey. Laura Elizabeth Cockle. Emma Jane Coles. Anita Marie Guest. Rebecca Jane Hull. Jeremiah Karambukuwa. Marie Theresa Kinch. Kelly Ogden. Hannah Elaine Ryan. Julie Denise Sherwin. Louise Diana Tierney. Brenda Orafua Varden. Wendy Louise Wildersman. For the award of Postgraduate Diploma Specialist Community Public Health Nursing Health Visiting, Helen Sarah Assel. For the award of Master of Science Children and Young People, Aisha Mohammed Saeed Al-Momari. Lisa Philippa Langley. Nairusia Yashath Began. For the award of Foundation Degree in the Sciences Management of Social and Affordable Housing, Alice Gowers-Taylor. Namule Olivia Mpela. Celestine Mukunumfendete. Viseo Omateo Oladipo. For the award of Bachelor of Arts, Youth and Community Work, Sarah Willis. For the award of Bachelor of Arts with Honours, Social Policy, Lorna Adam. Laura Cobbin. Sivia Davidson. Micah Fanimo. Jessica Jassis Denise Forrester. Catherine Ketty Katsande. Ruvimba Genthea Nkube. Lucy Parker. Chanel Kamima. Isabel Emily Rowe. Sarah Sparks. For the award of Bachelor of Arts with Honours Social Work, Hannah Alban. Melissa Bassett. Jacqueline Bolton. Emma Bowen. Kirsty Jane Conway. Melissa Ellen Downing. Lindsay Gartside. Emily Hogg. Danielle Justine Impey. Anna Karimuthumbi. Sharon Lewis. Tracy Lobban. Natasha Matthews. Melissa McNaughton. Natasha Nkwopara. Ufuoma Okpako. Suzanne Owen, who also wins the award for the Provide Faculty of Health, Social Care and Education bursaries. Kathleen Peasley. Angela Powley. Helen Ruenzo. Catherine Louise Smith. Rosanna Fleur Squires. Aileen Stanford. Susanna Stevenson. Christina Werner. Shannon Carroll Wiley. For the award of Master of Science, International Welfare and Social Policy, Olasankani Titus Agbulu. Aziz Yousaf Hamama. Ines Ramos. For the award of Master of Arts, Social Work, Heidi Chalkley. Jacqueline Crane. Hannah Guest. Isabel Garure. Jane Hammond. Kiara McClelland. Mary Odame. Stephanie Louise Sargent. Matthew Graham Tagg. For the award of Foundation Degree in the Arts, Early Years Playwork and Education, Laura Frith. Emma Gower. Faye Jolly. Charlotte Palmer Long. Charlotte Sale. Sarah Saul. Emma Wood. For the award of Bachelor of Arts with Honours, Early Childhood Studies, Chloe Frances Benton. Stephanie Louise Burnham. Rebecca Sarah Clark. Zoe Ann Hubbard. For the award of Bachelor of Education and Childhood Studies, Kieran Mustafa. For the award of Bachelor of Arts with Honours, Education and Childhood Studies, Fathia Abdi. Mona Ali. Hina Aslam. Natasha Ulrika Baines. Mary Bandera. Craig Blackmore. Kirsty Brennan. Ruby Camper. Anna Chatfield. Tasneem Dilafruz. Sasha Frost Palmer. Samantha Gregg. Alison Guscott. Rebecca Hargrave. Megan Hasselton. Eliza Grace Hopkinson. Sarah Jeffrey. Justine Jerica Jumawan. Claire Elizabeth Martin. Denica McGovern. Rachel Aderonke Odesanya. Kemi Olukoga. Joanna Pearson. Sabasawa. Sharon Turner. Sharon also receives the Dean's Award for the Department of Education and Social Care. Rebecca Whitbread. For the award of Master of Arts Education, Stuart Jens Peter Aldous. Olga Hopper. Gemma Ireland. Pauline Ann Martin. Verity Maudsley. Helen Francis Webb. For the award of Master of Science Management and Leadership in Health and Social Care, Rachel Margaret May. For the award of Bachelor of Science with Honours Mental Health, Shailene Nathan Dumasuka. Vice-Chancellor, It is my pleasure to present to you those who have been awarded higher research degrees. For the award of Doctor of Philosophy, with the thesis title, Israeli Arab High School Students' Perceptions of the Implementation of the English Curriculum and its Suitability to their EFL Metacognitive Language Learning Strategies, Samia Zed. For the award of Doctor of Philosophy, with the thesis title, The Use of Phonoarthrometry to Detect Osteoarthritis in the Human Knee Joint, a Clinical Proof of Concept Study, George Edward Bocking. For the award of Doctor of Philosophy, with the thesis title, Paths into Volunteering, Laura Ann Whiffen. Vice-Chancellor, that completes the list of graduates for me to present to you today.
Well done. Next time I must bring those earplugs. We're now nearing the end of the ceremony, but first I would like to ask Megan Hazelton, one of our wonderful new graduates, to come to the podium to propose a vote of thanks on behalf of those receiving awards today. Megan.
Vice-Chancellor, honoured guests, ladies and gentlemen, fellow graduates, I am delighted to be offering the vote of thanks today on behalf of all the graduates attending this ceremony. I would like to begin by thanking Anglia Ruskin for providing us with the opportunity to better ourselves and prepare us for our futures wherever this may lead. This has been an unforgettable journey and experience. We thank our lecturers for sharing their generosity of patience, knowledge and expertise with us. It is this inspiration and encouragement that has allowed us to stand here today as masters in our preferred fields. We must also offer thanks for the invaluable support of the university staff behind the scenes in the library, iCentre, student services and the faculty administration. Your support and guidance also has to be acknowledged as a major factor in our success today. I will not mention the library fines. Today is a special day, not only for us, but also for our families and friends. Your encouragement and sacrifices are recognised as essential elements to our educational journey. Thank you for sharing and celebrating this day with us. Now let us stand proud together and don't forget to say cheese in the photographs afterwards. As graduates today, it is a good time to reflect upon the last 3 years and the outstanding achievements that we have made and the great people and lifelong friends we have met along the way. Graduation is an exciting time and a time to look to the future and consider what will you do next, where will your degree take you, and what will your next big achievement be. Congratulations, graduates of 2015, we made it.
Megan, thank you. I now call for one final time on the Vice-Chancellor, Professor Michael Thorne.
And now, will all those who have been presented to me here today and have crossed the stage, will you now please stand? By the authority vested in me as Vice-Chancellor, I hereby admit you to the degrees, diplomas and certificates for which you have been presented to me here today. Our warmest congratulations to you all.
Ladies and gentlemen, that brings us to the end of the ceremony, and I declare the proceedings closed. Will you please now all stand for the academic procession?